Every time I give a therapy to somebody, it's always with a caveat, I don't know if this is going to work for you. And it's because it hasn't been tested in you and it's not specific for you. So what if you could do a test on the myeloma cell to see exactly what mutations the myeloma has, and then instead of picking something off the shelf to treat you with, that we pick something that is directed towards you. Because everyone that has myeloma has had a different journey to get there. Everyone has different mutations, a different mutation set. They've had exposures and things that have happened in their lives which have led up to having myeloma that are very unique. And so everyone's myeloma, although it looks the same under the microscope, is very unique. What if we can exploit the uniqueness and give somebody tailored therapy for just their cancer? And there is a way to do that. And this is actually happening in several places in the country, but it's happening in some of the myeloma centers where there is something called the ONCOSEQ. Actually, it's 17,000. And so it looks for 17,000 mutations in myeloma cells. So they get your myeloma cells from a bone marrow biopsy. They then isolate the myeloma cells. And they look at the genes just about in every way you can possibly read it. So this is all the benefit of the Human Genome Project, where it reads the DNA, which is a miracle. It reads the DNA off the individual plasma cells to find what mutations are occurring in your particular cancer using gene expression, looking for deletions and point mutations. I mean, it's unbelievable. This generates a gigantic amount of information, and then the computer basically reads it and then looks for a targeted therapy. So we know the common mutations in myeloma. We know that they're targeted drugs that are used for other cancers and used and built specifically for myeloma on one side. The question is how do you match the two? Because this is an incredible amount of information, this is an incredible amount of information, and it's the supercomputers that are able to pull this off that are just now available. So we're doing a clinical trial right now that gets patients with active myeloma, and they get their gene profiling from a bone marrow biopsy that uses and looks for it goes through 1,700 different mutations that are in cancer, but also known in myeloma, looking to see which mutations do you have in your particular plasma cells at that particular time. And right now we're at this point where we're looking just for the mutations, and the computer actually, it finds those mutations and then it runs through all the research that has been done. Like there was 1,300 papers in like an hour. I mean, it does this incredible computations. And then it matches your mutations to drugs that are available for other cancers or for myeloma, matches it to clinical trials all over the planet, and it matches it to potential other myeloma therapies that may have been overlooked or forgotten about.